Good evening, I'm Marivelle Tarouk. We begin with breaking news. The first presumptive positive case of the new coronavirus has been confirmed in Toronto. More than 1,000 cases of the new virus have been confirmed globally. This, of course, now the first one in Canada.
The case is in a male who's in his 50s. He had traveled to Wuhan, China, and come back, and within a day became quite ill, and the emergency service was aware of his travel history, used full precautions, was taken to Sunnybrook Hospital, and is now in a negative pressure room. All the staff are taking appropriate precautions, and the condition is stable.
Now, the Minister of Health was quick to say this was found thanks to the due diligence of the city and the province.
Working directly alongside our partners at the Public Health Agency of Canada and local public health units across the province, we have been actively monitoring to quickly detect and contain any cases of the Wuhan novel coronavirus. I want to assure all Ontarians that this is exactly what transpired. The system is working.
That announcement coming from Queen's Park just a few minutes ago, where health officials continue to take questions. Let's look in and dip into that conversation now.
The messages that my colleagues have brought forward, but in addition to say, obviously, at the hospital level, our job is to make sure we take the best care of the patient, and we're doing that presently. It's also to make sure that we continue to be prepared to take care of the populace of the city and beyond, together with our partners. And it's been stated, but let me emphasize, the degree to which we have learned from past events such as SARS, for example, is tremendous. So the degree to which we see an increase in the sophistication with how infection prevention and control measures are taken both in the emergency department, indeed even before, for example, with our paramedic colleagues, and then into the hospital. I'm very, very pleased and proud to see how that's worked extremely smoothly, and we need to, together with our partners across the health system, who are already, as you heard the minister say, increasingly integrated and connected. We are certainly will be working together on that. And the third point I want to make before I pass to my colleague, Dr. Leese, is in all of this underscore just how important it is to take care of the patient and the populace, but also our healthcare teams. So certainly at the top of my mind is making absolutely certain that we are empowering and making sure that our healthcare teams, which are so critical to be able to not only take care of patients but be protected themselves, are done. So those are the three things that are top of mind for me, and maybe I'll pass the microphone to my colleague and he can give a little bit of sort of more general information about the care of the patient.
Thank you. So Dr. Jerome Leese, Medical Director for Infection Prevention Control at Sunnybrook. When the patient arrived to Sunnybrook, they were actually immediately identified as being a patient that should be a person under investigation for this particular virus. At Sunnybrook, just like at other hospitals across Canada, we have established infection prevention control protocols, and so it's just our usual practice to screen all patients on arrival for the presence of any respiratory symptoms or fever. And so this particular patient was immediately identified, and we had the travel history immediately as collected by the emergency services, and they were immediately placed into the appropriate precautions on arrival. So we've instituted the appropriate precautions for in acute care hospitals as recommended by public health, as well as provincial guidance as well, which includes the use of personal protective equipment and a negative pressure room for air circulation. And that's where we've been caring for this patient since their arrival.
Can you talk to us about the proportion of patients who are infected with this that die, to the best of your knowledge, and what the transmissibility of this is?
So I first want to emphasize that we are still learning about this particular virus, and so some of those questions are difficult to answer at this time. I can tell you that from the literature that is rapidly coming out in terms of this virus, and we've learned an incredible amount in the past month, in the healthcare settings where where healthcare workers have managed these cases, the risk of death has been in the range of around 10%. But I think we need to be careful with those numbers because in Canada, we have established protocols. Many of those cases may have been in a situation where they didn't actually know the virus. They may not have recognized the infection. In this specific instance, we identified that they might be at risk immediately and have placed them into the appropriate precautions. We're providing supportive management, and currently the patient is stable.
In terms of
You have been listening in on a news conference out of Queen's Park by Toronto and province of Ontario health officials, as well as officials from Sunnybrook Hospital, on what is being called the very first presumptive positive case of the new coronavirus in Toronto. That also makes it the very first case to be identified in Canada. Officials say that the patient is a male who arrived in Toronto on January 22nd. His flight was from Guangzhou, China. Symptoms were he was feeling ill and he asked family to call 911, went to Sunnybrook Hospital the next day. Officials say lab results were received this afternoon. The man is currently in stable condition. Sunnybrook Hospital adds that the immediate protocols were undertaken as soon as the patient arrived and was identified in the hospital. The patient and the family are in self-isolation. The province has started a new website as well to keep everyone updated. That is ontario.ca/coronavirus, and we will update this story as more details become available and bring you those updates as soon as we get them. But moving on to the epicenter of this story, China's president today described the outbreak as a grave situation. He made the announcement after a special government meeting on the Lunar New Year holiday. The virus has killed at least 42 people in China since it developed in December. It has affected more than 1,400 people. Most of the cases are in China. The Chinese government has imposed travel restrictions in several cities. Hong Kong authorities have declared the highest level of emergency. Cases of the virus have been reported in at least 12 other countries, of course, Canada now being one of them. Well, China quarantined millions of its citizens to try to prevent the virus from spreading. But it wasn't enough. Cases of the deadly virus are now being reported around the globe. Now, in addition to Toronto and Canada, the virus has now spread to multiple countries in Asia, including Malaysia, where 3 new cases have been reported. It's also spread to Australia with 4 cases, and to Europe with 3 confirmed in France. In North America, 2 U.S. officials report 2 coronavirus cases, one in Illinois, the other in Washington state. All of the patients visited or have had family members who visited Wuhan, the Chinese city, at the center of this outbreak. We turn now to other local news. 4 people were sent to hospital after a fire broke out in the northwest of Toronto. It happened this morning around 2:30 on Weston Road north of Eglinton. Flames could be seen coming from a building. Firefighters found a woman in her 30s on a stairway inside. She was sent to hospital in life-threatening condition, but she is now stable. 3 other people were sent to hospital as well, including a man in his 50s who is in serious condition. It took dozens of firefighters and 9 trucks to extinguish the blaze. The cause of the fire is not yet known. The bodies of 2 Iran plane crash victims returned to Toronto today. 37-year-old Sahar Hajju and her 8-year-old daughter Elsa Jadidi are being remembered by friends and family. Sahar's father and Elsa's grandfather, Habib Hajju, says since the death of his girls, as he called them, time has stopped for him. A burial for Sahar and Elsa is taking place at 10 a.m. tomorrow at the Imam Mahdi Islamic Center. Habib says he wants the entire country to come out and help put his loved ones to rest. Okay, we're going to take a look now at how the weather is shaping up for this weekend, and Sonia is here with that. Hi, Sonia.
Hi, how are you? Thank
Okay,
you so
thanks.
much for that. Well, let's take a look at this system. It is making its way out. It will depart Ontario tonight, but we are seeing that wraparound snow. But not to worry, that snow will not be continuous tomorrow, although certain areas will see some light accumulation. But let's take a look at the temperatures. Very mild. Coming on Tuesday, we will be above seasonal. We also see a transition to southwesterly winds that really are keeping things a lot milder over the next couple of days. The wind gusts, though, could be stronger going from Toronto through to Kingston. And let's take a look at the amount of snowfall that we could see. Most of this will be tomorrow. So just a dusting in and around the Toronto region. We'll see up to 10 centimeters closer to Ottawa through to the Cornwall region. And then, of course, north of Parry Sound. Again, most of that will fall tomorrow. So it could impact our travel. So really the 401, 407. So 407 from Markham GTA through to, again, the Cornwall region could be impacted over the next several days, though Toronto looking kind of great through to the weekend.
All right, we'll see you in a bit. Thanks, Sonia.
Thank you.
Chinese people across the GTA are celebrating the most important day of the year, Lunar New Year, a time in Chinese culture to celebrate with food, family, and hopes for the new year. We sent our Angelina King to a celebration in Toronto's Chinatown to explain the celebration and the symbolism.
1, 2, 3!
A big celebration to mark the most important day on the lunar calendar.
And I wish everybody healthy and good luck and Happy New Year.
While many may think Gong Hei Fat Choi translates to Happy New Year, there is a deeper meaning.
Healthy and prosperity and good luck for all family.
What are you kind of hoping for this year?
I guess happiness, family, I don't know, wealth.
Spending time with family, love, and happiness.
How do you like to celebrate Chinese New Year?
Lots of food.
Lots of food, definitely.
Yeah, lots of family time.
It's also a day to give or receive lucky money.
The lucky money is received from the children by the elderly, and if you're married, then you should give lucky money. But if you're single, you're not supposed to, or you don't have to. But it's always nice to receive lucky money in any case.
And this is the year of the rat, the first animal of the Chinese zodiac, representing wealth, abundance, and new beginnings.
The rat is a quick-witted animal. That's how he becomes the first animal of the zodiac. As we know, the rat rider showed up the ox and jumped ahead of him at the line.
For many, it's a day to celebrate old traditions. For others, a time to learn about a different culture.
I wanted to take the kids to Chinatown. We never been before to Chinatown since we're here, and that's a good opportunity to see how they celebrate the New Year.
A symbol of celebration, the traditional lion dance.
Grabbing the lettuce is a way of the business actually thanking the lions. So by giving lettuce, it's a form of feeding the lion. The dance means to bring fortune and to also drive away bad luck from the previous years.
While hoping for a year filled with health, prosperity, and good luck. Angelina King, CBC News, Toronto.
I'm standing here today, again, to announce my candidacy for the leadership of the Conservative Party of Canada.
He's all in. Peter MacKay officially enters the race to succeed Andrew Scheer, joining the list of candidates hoping to take the top spot. Details coming up. Revisiting our top story, Canada has confirmed its first presumptive case of the deadly coronavirus here in Toronto. Health officials making the announcement just a few minutes ago at Queen's Park. Our Queen's Park reporter, Mike Crawley, is at the press conference and joins us live right now. A lot of details from this press conference, Mike. Let's first start with, if we can, what we know about who's been infected.
Okay, Marivelle, so I've just come from the news conference, was inside here at Queen's Park, quite a number of health officials. They told us that a 50-year-old man traveled from Wuhan, China. We don't have an exact time of date of when he was there, but we do know that he left China on January the 21st. Then he arrived in Toronto on the 22nd, was feeling sick fairly immediately, and he went to hospital on January 23rd. Now, because he was not feeling well and had come from Wuhan, the epicenter of this virus, the ambulance attendants were informed of this, and so we're told by these health officials that the paramedics were all fully protected when they took him to Sunnybrook, and he was immediately put into an isolation chamber. So a lot of the questions at the news conference were about whether this man was potentially, any other people were exposed to him. So obviously the public health officials are looking closely at his family members, but we're told he did not have close contact with many others. It's unclear at the moment in terms of the plane. We're told it was a plane from Guangzhou to Toronto that would have arrived on the 22nd. We're told that it seems that if people are not symptomatic, if they're not sneezing and coughing on the plane, that they would not necessarily be spreading it. But at the moment, the public health officials are still trying to trace anybody who he may have been in contact with. The general message, though, from this news conference is that, you know, Ontarians should feel safe, that the systems are working, because this patient was, immediately identified. All the protective protocols were put in place, and the lab confirmation of this, it's called a presumptive confirmation, that came through earlier this afternoon, and public health officials were within hours organizing this news conference to inform the public. Marivelle?
Certainly, I guess that experience of SARS that they talked about, having learned the lessons from that experience, Mike. But what about in terms of the prognosis for this patient? Was there discussion about that?
Yeah, we're told his condition is stable. We don't have a lot more information about it, but apparently there are degrees of this virus that some people may actually come down with it, but not actually feel terribly sick. The general sense, we were told by one of the officials from Sunnybrook, is that of those who are sick with it, it has approximately a 10% fatality rate. But the information is really unclear. It's still in the early stages in terms of our scientific knowledge of this. But at the moment, we're told that this man's condition is stable and that he is in an isolation room at Sunnybrook.
All right, Mike, thank you so much. Appreciate it.
You're welcome.
Now, Mayor John Tory issuing a statement in just the past few minutes. He says Toronto Public Health is continuing to work closely with provincial and federal health colleagues to actively monitor the situation and respond as appropriate. He goes on to say our frontline healthcare workers are the best in the world and have procedures in place to keep people safe. Well, in other news tonight, it is official. Peter MacKay is in. The former cabinet minister launched his bid for the federal Conservative leadership in his home province of Nova Scotia this morning. Hannah Thibodeau is in Ottawa with the details.
23 years after his first political run, Peter MacKay entered a new race.
That's why I'm standing here today, again, to announce my candidacy for the leadership of the Conservative Party of Canada.
MacKay wants to lead the party he helped create. He was leader of the Progressive Conservatives when they merged with Stephen Harper's Canadian Alliance in 2003, forming the current Conservative Party.
And I've played my part in uniting the Conservative family into one big blue tent.
And he says he wants to keep the party united.
I stand here before you today with my heart on my sleeve. For every Canadian, whoever you love, wherever you live,
That's a change from Andrew Scheer, who wasn't clear in the last election about some of his personal views on social issues. And that's divided some conservatives.
And if we don't unite, there is a risk to our party, but there is also a risk to our country, for democracy demands choice and competition. We are in danger of more years of Justin Trudeau.
McKay also took direct aim at the Prime Minister, pitching himself as a better alternative.
And leadership on the world stage requires serious diplomacy. To advance Canada's interests requires authenticity of action, measured by outcomes, not selfies or photo ops or dressing up or dancing.
At least 12 Conservative MPs have put their support behind McKay, including Carrie Lynn Finley.
It does help build momentum, but then any support helps build momentum, and that's a factor for anyone running for a leadership position.
McKay is considered the front runner after other heavyweights like Jean Charest, Rona Ambrose, and Pierre Poilievre opted out of the race. His main competition is expected to be Ontario MP Aaron O'Toole, and today O'Toole announced his leadership bid will be launched on Monday in Alberta. Hannah Thibodeau, CBC News, Ottawa.
A group of teens says sustainable is what's in style. They hope to change a few shoppers' minds today. Talia Ricci checked out the Fashion for Futures pop-up shop put on by a group called Youth Challenge International.
There were thrifty finds, one-of-a-kinds, and garments sewn by hand. But there was also a theme to this fashionable event.
I try to make kind of like trendy clothing out of sustainable textiles and like surplus fabrics.
There's plenty of sustainable brands out there. They're just sometimes not as prominent because they're not making as many clothes because they're more environmentally conscious. So we really wanted to give them a platform.
The Fashion for Futures pop-up shop was for eco-friendly designers and conscious consumers.
A lot of people will just buy a lot of content or a lot of clothes and then just throw it away and then go back and buy more.
The teens who organize the event say they hope that visitors enjoy the sustainable shopping experience, but also leave more educated on the impact of fast fashion.
To try and solve some of the climate change problems that are affecting us on a municipal level, because we all have a lot of eco-anxiety around the issue, especially Generation Z, because we're the ones who are going to have to tackle climate change when we're older.
Shoppers were encouraged to make pledges to reduce clothing waste and go through these stations that show the life cycle of fast fashion.
And then finally, when we end off in the landfill with kind of methane being released from all the clothing being put into a landfill.
The teens hoping to eventually see clothing on the runway the sustainable way.
I wanted to get into fashion and like start a brand and start doing something in it, but there's a climate crisis going on and I definitely didn't want to contribute to that. So I wanted to find a way to still like do something that I wanted to do and not contribute to that industry in that sort of way.
Talia Ricci, CBC News, Toronto.
Now, recapping our top story tonight, Canada has confirmed its first presumptive case of the deadly coronavirus here in Toronto.
We have somebody who's had very little external contact, not much by way of activity, and we're going to continue our investigation at this stage.
The case was confirmed just this morning. It was a man in his 50s who had traveled to Wuhan, China. Officials believe his family may be the only people who he's had contact with. However, a new website has been created by the province for anyone who wants more information.